Welcome, everyone. Thank you for joining us today for our ASPPH Presents webinar, Career Spotlights for State Health Departments. My name is Morgan Shire. I'm the Manager of Student and Alumni Engagement here at ASPPH, and we're happy to bring you this webinar along with our partners at ASTO. Just a quick housekeeping item before we get started. You may use the Q&A feature throughout today's webinar. You'll just click the icon at the bottom of your screen, and then you can type in your questions there. We'll be monitoring the Q&A throughout the webinar, so just put your questions in there and we'll get to them. Now I'm happy to introduce our moderator for today's event, Joanne Pearsall. Joanne, I'll toss it over to you to introduce yourself and get started.
Thank you, Morgan. Hi, everyone. I'm happy to be here today. I am Joanne Pearsall. I am a Director of Workforce at the Association of State and Territorial Health Officials. I have a past in local and state governmental public health, as well as in an academic institution where we provided services and technical assistance to our local and state governmental public health jurisdictions. So it's really been my whole career spending time in or supporting governmental public health. I'm really happy to be here today to do two of my favorite things. One of which is to talk to the next generation of the public health workforce. And the second is to hear people's stories about where they've been in their careers and how they got to where they are today in their public health journey. Before I open it up to our panel, I did want to share with you a little bit about the association that I work for, just to provide a little bit of context. So the Association of State and Territorial Health Officials, our mission is to support, equip, and advocate for state and territorial health officials as they do their work every day in advancing public health and well-being. We are a membership organization. We are nonpartisan. Our members are the chief health officials from 50 states, Washington, D.C., the 5 U.S. territories, and 3 freely associated states. In our work, we also support a network of peer groups representing those organizations. Those peer groups of senior leaders and executives in those organizations represent the 100,000 plus workers that are in state governmental public health agencies across our country and the territories. The programs at ASTO follow a traditional public health program organization. So we have program areas such as preparedness, environmental health, chronic disease, maternal and child health, communicable disease, to name a few. We also have some cross-cutting areas, which include public relations and communications, legislation, policy areas, as well as the area that I'm in, which is workforce. So those are a couple of examples of the type of work that we do. We have over 300 employees now. We are headquartered just outside of Washington, D.C. We have a satellite office in Atlanta, Georgia, close to the Centers for Disease Control and Prevention. Our staff primarily works remotely, and we have folks that work or that live across the U.S. Mainland. The folks on my team, I think, represent 4 or 5 different states, and we are right now across 3 different time zones. So this slide shows a little bit in plain English the role that ASTO has in supporting public health. We do a lot of leadership development and leadership support for our members, and we help to support agencies as they improve the health of their populations through our capacity building and technical assistance and educational products, as well as being thinking partners for those leaders. We also advocate for resources and policies. So we have a strong presence in Washington, D.C., and we're supporting the improving of health and well-being for all of residents. So we are not a governmental entity. We are an association. However, we do regularly interact with federal agencies such as the Centers for Disease Control and the Health Resources and Services Administration. In fact, we receive considerable funding from organizations at the federal level. Our members are state, territorial, and freely associated public health leaders. And we also have a sister organization, the National Association of County and City Health Officials, that represents the thousands of local governmental public health agencies across the country. We work collaboratively with many of those federal organizations and with NACCHO and a handful of other associations that represent specific disciplines in public health. We also work with nonprofit and philanthropic organizations to accomplish our work. I invite you to go to asto.org and sign up to receive our regular communications. We have a weekly newsletter that goes out. We also have a daily newscast that is put out every day. It's no more than 10 minutes of public health news that is done on the morning of every weekday. We also have regular podcasts, policy statements, and other communications that might be of interest to you. So I encourage you to go to the website and sign up for some of those communications. In addition, we have a pretty strong social media presence. We are on Facebook, we are on LinkedIn, and we are also on X, formerly known as Twitter. One of the things that I wanted to call out to you specifically today is our publichealthcareers.org website. That is, it's been around for about a year now, and it is a one-stop shop for governmental public health positions, both for job seekers as well as employers. Employers can post jobs to that site, and job seekers can go to the site. We have a growing library of brief videos that share career stories with individuals and also highlight some of the good work that's being done in public health across our membership. So I encourage you to check that out if you're in the job market or just are curious about what kind of openings are available presently in governmental public health. Okay, without further ado, I would like to turn it over to the panel portion of our webinar today. We are lucky enough to be joined by three excellent panelists in public health professions, each with a little bit of a different role, representing different organizations. And so we're going to start off by asking each of them in turn to share their name, their title, their organization, their degree, and a brief description, if they can do that in just a couple of minutes, of their responsibilities. And then I'd also like to throw in the question about what they find most rewarding about their jobs. We'll hop into our panel, and Leanne, since your picture is the one I see first, I'll turn to you to go first.
So, hello everyone. My name is Leanne Allerid. I am a health educator too, also called local care representative at the California Department of Public Health in the immunization branch. I have my master's degree in public health from UCLA, and in my job, I work with the immunization registry, so helping train medical providers throughout the state to document patient vaccines in the registry. And also, the most rewarding part of my job so far has been being part of the COVID vaccine rollout when the COVID vaccines first came out, to get all of those documented, to get the patients in California vaccinated. And I apologize, my video was off, but hello, glad to have everyone here.
Thank you for that, Leanne. We see you now, so thanks for popping your video on. We'll turn it over to Sandy next to do your intro.
Good afternoon, everyone. My name is Sandy English. I am Deputy Chief of Recruitment Outreach at the Maryland Department of Health. In my role, I am responsible for just handling several different recruitment activities as far as outreach, attending job fairs and different outreach events, holding our own events, doing things like this panel, just promoting our roles to the public and helping to find different candidates and informing people of what Maryland Department of Health does. We do sourcing, advertising, so all of the sort of marketing of our roles. I graduated from Hampton University with a master's in business administration. I also received my bachelor's from business administration from there as well. And what I find most rewarding about my role, being in the Office of Human Resources, particularly working in recruitment, I get to meet people all the time and learn what their passions are and connect them to the roles that we have. So it's rewarding to see when you meet different individuals and you try to help them apply for our positions and try to find positions that they'd be interested in to see them get hired.
Great. Thank you, Sandy. That sounds like a dream job. Thanks for sharing. And we will go to Karen Vincent next.
Yeah, hello, everybody. I'm Karen Vincent. I'm the Organizational Advancement Officer in the Division of Public Health at the Nebraska Department of Health and Human Services. I do a lot of different things. I manage all of our legislative activities. I work with our teams on developing performance measures and performance management systems, strategic planning, the Public Health Department accreditation, workforce development, among many other things. And so for workforce development, we do a lot of work in both identifying training opportunities and supports for our current workforce, but also partnering with academic institutions to work with students and to get students placed in our organization for internships, for hopefully future jobs. So we do a lot of different things around workforce development. And I think that's probably the most rewarding part of my job, is really being able to both support who we have now, but also kind of work with that next generation to get them excited and excited about working in government and get them into the organization. I have a master, an MPH in maternal and child health from the University of Nebraska. And I'm also in the dissertation phase of a DRPH through Johns Hopkins.
Great, thank you, Karen. So I now have some questions that I'm going to throw out to our panelists. We'll also be taking your questions in the Q&A pod. But I'll throw out a question or two to get us started. So I'm curious. I'm going to reverse the order of a couple of my canned questions. I'm curious, and Karen, I'm seeing you on screen, so I'm going to start with you. If you could share what drew you to this work?
It's a good question. I actually started college. When I started my undergrad, I was pre-med and had every plan to go to medical school. As I was going through college, my brother was in medical school, and I kind of saw that whole process and realized not for me. And I also, at the same time, had the realization that what I really wanted to do was impact and help communities and populations. And medicine is more individual based. So I was more focused and more interested in really supporting communities, really supporting maybe people who need a little bit extra help, helping full populations rather than individuals. So that's really kind of what drew me into public health initially.
Great, love those medical profession converts. Thank you. I'll ask Sandy I'll turn to you, same question. What drew you to the work that you're doing?
So I kind of stumbled into public health. As I mentioned, I majored in business administration. And I started off, I'm in the Office of Human Resources. So I've stayed in the Office of Human Resources my whole time with the Department of Health. I started off in classification and then moved to recruitment, which is where I've spent a majority of my time. But just working in recruitment, learning about all the different roles within public health, I've grown to love public health and being able to support the organization and finding candidates to fill those critical roles to help support the mission. So even if I were to ever leave this organization, I think I would still be interested in continuing at another public health organization.
Thank you. I'm curious what, Leanna, will go to you for this question first. What coursework was most relevant in your public health work now?
Yeah, so I did my master's in public health with a concentration in epidemiology. So it was very like epi data heavy. So just doing like even the methods courses to get a good solid foundation on like understanding public health data and how to think critically about data collection and just the nuances and challenges that come along with that. I think was a good foundation for me. And then along with that, I took a really interesting course on public health surveillance that kind of, it piqued my interest in different surveillance systems and the importance to public health for vaccine tracking, pandemic tracking. And this was before COVID, so that wasn't even like a thought at that point. But I was able to have like a project for that class where I interviewed someone with the Vaccine Preventable Disease Control Program, and they use the immunization registry. That's the branch of the state that I currently work with, the immunization registry. So it was like, that's what first piqued my interest specifically in vaccine preventable diseases, but also as like a career path and something that was really interesting for me.
Thank you. Karen, I'll turn to you next for the same question.
Sure.
Coursework that was relevant, and then I'm going to throw in one from the Q&A pod too, because it's kind of related.
So I did my MPH in maternal and child health, but I have ended up for most of my career doing policy work. So it's been kind of I would say the MCH coursework was maybe not as relevant, although, you know, communication, problem solving, those types of skills that you learn in any of your classes would translate to any position. So I'd say that of my MPH coursework, probably the most valuable was coursework around evaluation, program evaluation. I don't do necessarily evaluate programs specifically, but the work I do with performance management, with quality improvement, and even policy, legislative assessment and analysis. I think those evaluation skills have really helped with all of that work to be able to set metrics, to be able to identify, you know, what is it that we're doing? What are our activities? How can we get better? How can we improve? What do we need to get better or to improve? And with the policy and legislative analysis too, I think really being able to critically think about what I'm reading, what I'm seeing, and think through kind of some of the impacts of that and what would that do to our specific programs, or what would that do to impact public health in Nebraska? So really that evaluation, and I'd say also too some of the research methods classes to be able to think through all of those pieces.
The bonus question for you, Karen, and you, I think, touched on this a little bit in your response, but we have a question about talking a little bit more about your experience with the DRPH,
Sure.
how you decided on Johns Hopkins, and how you made that choice between a PhD and a DRPH.
Sure, that's a great question. So I'm going to answer the second part of that first. I landed on, I did a lot of thinking about DRPH versus PhD, but my passion, my goal, my career, and I know my kind of future trajectory is all in practice. I really don't have any interest or desire to be in research or to be in an academic setting full time at least. So the DRPH was a good fit for me because I was really interested in, am still very interested in a practice focus and um, kind of that practical side of the degree. Um, Johns Hopkins, I applied and started the program in 2018. So pre-pandemic, at the time, I was very specific in what I was looking for. I was looking for a degree in some sort of policy or leadership type of concentration. I needed it to be fully online because I didn't want to have to quit my job and move somewhere. And then I was also looking at accredited programs. So I was kind of limited in what schools had what I was looking for. And um, in all honesty, I applied to, I think, 3 programs, and Johns Hopkins was the only one I got into. So I didn't want to wait for other programs to kind of pop up. And so I just went and I got started there. I know now there's a lot more programs out there that would meet those same criteria. So I don't have good advice about choosing a school. I went to the one that I got into. So that's kind of how I landed at Johns Hopkins. And I'd say really just the experience, um, it's been great because I work in policy and my degree is in policy. I've been able to really take what I'm learning in class and in my academic studies and apply it in my job to kind of really get that practical application as I go along rather than having to wait, to post-graduation to be able to do that.
Thank you. Sandy, I'm going to turn to you for this next question. And if you want to pass, you can pass because it's about challenges. Just curious about any challenges that you face in your role.
Definitely. So the challenges that I face in my role are more with trying to find enough candidates for the many roles that we have that we support. So it's more so just finding that talent and attracting the proper candidates for some of the positions that we have. I know we have some experienced roles, but then we also have some entry level positions as well. But the main thing would just be just attracting those candidates, finding people with certain skill sets, sometimes just figuring out where to find those candidates.
A great follow-up question to that is, can you describe the typical hiring process?
Okay. So with the Maryland Department of Health, we have certain guidelines that we follow in our hiring process. All of our positions are posted for a minimum of 2 weeks. They may be posted longer than that. Once you've applied for the position and the position is closed, we allow up to 3 weeks for our recruitment analysts to review candidates. We actually have people who review each individual application. It's not run through a computer system. So that's where it's important for candidates to spell out their experience and put it in terms that those recruitment analysts that are reviewing it can understand. But we review those applications. We rate the applications based on education experience, a combination of different factors, desirable qualifications. Sometimes candidates are placed into categories of best qualified, better qualified, and qualified. We create an eligible list. So at this point, by the time we've created the eligible list, like I said, we allow it to 3 weeks for the recruitment analyst to review those candidates. So that process from when you've applied to when you've been placed on an eligible list could take probably about a month or a little bit longer. We give that eligible list to our hiring managers, and at that point, it's their responsibility to invite candidates for interviews. They'll go through, interview candidates, and make a selection. If they were unable to make a selection, then we may repost the position and kind of start over again. But all in all, from when the position has been vacated to when we fill a position, it could take up to about 3 months. And that varies with each position. Some, the timeline is much shorter, some it's much longer. But that's typically how our process goes here with Maryland Department of Health.
Leanne or Karen, do you have anything to add that is either very similar to Sandy's organization, or maybe like the complete opposite of that, of anything that she described as far as hiring processes?
I think our process is fairly similar. Applications go into a application portal, are reviewed by a HR, a human resources, talent acquisition partner is what we call them, and then forwarded to the hiring manager. I'd say our process is maybe a little bit shorter. I think ours only have to be posted for 5 days before they can start being reviewed, but getting a job in government is not a quick process usually. So unfortunately, it takes some time.
I think that's pretty consistent with what we've heard from our members. So I think one key piece of advice maybe to applicants is to start looking early and be patient. Other career advice, I'm just curious from any of our panelists, what advice would you have for someone that's trying to get into governmental public health? And maybe if there's anything special that you would recommend for someone with limited experience.
So I think I can speak to that. And it goes well after the hiring questions. So when I first started in my role, I had very limited public health experience, like pre-graduating. I went straight from my bachelor's degree to my master's degree. So really the only public health like hands-on experience was for my internship. So what helped me was more so networking, like don't be afraid to network when you're in like school setting events. If you have like a professor that you like, classes that like really speak to you. That's what kind of got my foot in the door with my current position, is being able to have like a project with one of my classes where I was able to interview someone that was working with the public health, the immunization registry. So just network, you never know who you're going to meet that like sparks your interest. And I hadn't really thought of that as a career path or like a job path until I was 6 months into my job search, post-grad. I was working at Starbucks, just trying to get into a job that I like can actually use my degree for. And I went to the interview and I was like, wait, I've been to this building before. I know exactly who this is for. So it was more so networking is going to help you if there's not as much like hands-on public health experience.
Thank you. I appreciate your including your personal story in the answer to that question. So I'll turn to Sandy and then to Karen, curious about advice you would have and for individuals trying to get their foot in the door.
I definitely agree with Leanne, and networking is important. Taking on internships. I failed to mention in my intro that I oversee our public health workforce development internship program, and we're on our 5th cohort, and I've seen several of our interns get hired into positions upon ending their internship. And even if you don't get a chance to get hired into a role, maybe there's not one available, just staying in touch with those individuals that you work with. I know we have a lot of people who have graduated from different schools of public health. So it's a good pipeline, just staying in touch with those individuals. On top of that, except for our internship program, it's open to recent graduates as well. So it's not just current graduates. So those who are still kind of trying to find that role, they can still function as an intern with us. I'd say also looking at the jobs that you want. looking at those requirements. I know for us, like for our health policy analysts, for example, our entry level to our health policy analysts is more broad. It asks that you have experience in quantitative and qualitative analysis. And as you move into the more experienced level, your experience is more specific to health. So knowing that, even if you take a position, maybe that's not in public health, but has those skills, you can gain those skills to get get that experience to get your foot in the door for a role with us.
Great. Thank you. Karen.
Yeah, I'd add too the importance of networking throughout your program, throughout your degree program. I got my job at the state health department, my first job at the state health department. I've moved between some different positions, but the first job I had that kind of brought me into the department was because of networking. I made connections with people from my College of Public Health who connected me with leadership in the state health department, who then told me, hey, we have this job available, come interview. So I didn't necessarily follow the same path that most people have to, but that's how I got my foot in the door because I was able to meet the right person. As far as, recent graduates or new graduates or people graduating soon, I'd agree, apply early. Things take some time. And maybe be a little bit, you may have an idea about what you want to do or what type of program you want to be working in, but be open to different things or things that maybe not in the what you initially thought you'd be doing or what type of work you think you want to be doing. Be open to other things. For example, my degree is in maternal and child health, so I thought for sure I'd be working in maternal and child health programs, adolescent health, adolescent sexual STD prevention, pregnancy prevention was really where my interests were in graduate school. But as I took my first job out of school, I ended up in more of a policy type degree and really fell in love with it. So it's not initially what I thought I'd be doing, but really fell in love with policy work, with kind of systems level work. So that's where I've stayed because it's really exciting. I love what I do, and I love being able to kind of work across all of the public health programs and support our full system. So like I said, really be open to maybe things that aren't in things that you may not think is in your wheelhouse.
So it never ceases to amaze me what a small world public health really is. You can meet somebody early in your career and 10 years later they pop up at some event that you're at as well, and you still have that connection with them. So I will throw out another question to you all. This is from the Q&A pod. Curious, and it's not a trick question, I don't think. Curious about how did you decide to work in the governmental sector and state public health rather than a nonprofit or a healthcare system or some other setting? And Karen, you're on my screen. I'll open it to panelists as well.
In my undergrad or in my MPH program, during that program, I worked for a nonprofit. And my first job out of graduate school was at a local health department in Nebraska. So I kind of have some experience across the board, across a few different sectors, at least in Nebraska. And landing in state government was, like I said, as I mentioned earlier, I like the systems level work. I really like to impact and work across the full system. So I'm able to do that at the state level, at the state health department. We don't do really much direct service. We really work closely with partners across the state who then provide the direct service. But at least in the role that I'm in now, I am able to kind of support people, support the people who help the people. So support our local health departments who are serving the public directly, support, work closely with our academic partners and work with our current workforce and students to be able to kind of make a difference. So for me, state public health for me is really an opportunity and an exciting chance to impact a broader system.
Karen, Sandy or Leanne? Government versus other sectors.
So I kind of just fell into my position. I didn't really necessarily have a preference of like private sector, nonprofit versus like local health department, but like working for the state, like centered in Los Angeles County, LA County is a big employer for this area. So I feel like it's really emphasized in, or at least was in my graduate program, that like that's always an option. So it's nice for like job security purposes as well, especially like post-pandemic. I feel like everyone is talking about public health, and like it is very important. So I think government, it's nice to have like the job security aspect of it as well.
Thank you. Sandy, do you have anything to add to that?
Sure. Well, all of my experience has pretty much been in government. So I can't speak on what it's like to work outside of government. Even my internships that I had in college were all different with different government agencies, whether it was local government or federal government. But there's definitely a lot of opportunities, and you can move between different agencies. You have that flexibility, um, and and like so, there's just lots of opportunities for growth. You can There's a lot of benefits as well. And I know us as an organization, we're like working to implement some other things to enhance that for our employees. One of them being like offering certificates and things like that. So there are other benefits to being a state employee other than just like health benefits.
So another question from our Q&A pod is whether you recommend sitting for any of the exams for certifications in grad school, and is that necessary to have a job in governmental public health? Open it up to anyone.
I took the CPH exam, the Certified in Public Health, shortly after I graduated. I don't know that it really made much of a difference in whether or not I got a job or not. So I can't necessarily say whether or not it's recommended. I know there are some exams that are more technical that really are important, and can make a difference in whether or not you get an interview for a job. As far as the CPH exam, truthfully, I don't know that it did much for me in my process. And as I hire people, I don't necessarily look for that. I have still maintained the certification and keep doing it, because I do think it's valuable, and it was valuable for me to be able to kind of brush up on my skills and make sure I'm up to speed, or was up to speed on kind of what's going on in the field. And I think maintaining the certification also helps me focus on some professional development, make sure I'm doing my own professional development throughout the process.
So I agree that that's not something that, at least as a recruiter, we haven't had a ton of recruitments where it required an extra certification. There are some positions where maybe if you don't have the relevant experience, where a certification could substitute for that and may help you in that way. But it's not something that I think is necessary to that would make a huge difference in your ability to get in the door. But it varies with certain positions. We do on occasion have something where maybe the hiring manager might prefer that you have certain certifications, but it's not that common.
Thank you. Leanne, don't feel obligated, but did you have anything to supplement with?
No, I didn't do any certifications. I know some people have them. I know chess is a really common one for like health educators, but I've been okay in my role without it. So I would say it's do it if you want to, but don't feel like obligated.
Thank you. There are a couple questions in the pod about whether you hire international students or international workers. So anyone can respond to that question.
I think that really depends on the department or where you're looking and the policies of that, both department and that state. We have a policy in Nebraska that we will hire international workers, but we don't offer sponsorship. That's just a policy of the state that we don't offer sponsorship for those visas. So I think it really kind of depends on where you're looking and the policies of that particular state or that agency.
And I answered that in the chat box, but we typically, it's a rare occasion where we sponsor, just because it's such a hard process for us and it's a lot of things that have to be involved for that. But we hire interns, we'll hire contractual employees that are international, but in terms of our permanent roles, we don't offer sponsorship very often.
So I have a juicy question for you all from the Q&A. How does the current state of the government and politics impact the line of your work, if at all?
If I can jump in on this one first, I do apologize, but I have to leave in just a couple of minutes. These jobs can be unpredictable, and I had something come up at the last minute that I have to go do, but I would like to answer this question just a little bit.
Go for it.
I think one thing that surprised me the most, or the thing that surprised me the most when I started in state government, was how political it gets. I work, and the whole time I've been here, I've worked in higher level leadership positions where I have I have more exposure to the legislature and the governor's office than maybe people working in specific programs do. But I was very surprised at how political it can be and how much politics can impact the work that we do. Our agency directors are governor appointed positions. So they report and work for the governor, which means we as an agency report and work for the governor. So our policies are the governor's policies, or his policies are our policies. So it's been a very, that took a long time for me to get used to. And sometimes it's still difficult, but as leadership and state leadership changes, as elections happen, that really impacts a lot of what we do, as far as policy type decisions. So, some of the hot button issues around reproductive health or vaccinations even. Nebraska is a very conservative state, and so there's some things that are very difficult to do in the state because of the politics around it. And I do have to leave. I'll put my email address in the chat. Feel free to reach out to me after the fact if you want to ask more questions or get more information. I'm happy to chat later on.
Yeah, thanks for being with us for the first part of our webinar, Karen, and great way to end on the juicy question. So thanks for joining, and we'll turn it to Sandy and Leanne if you want to take on that question.
I guess I can go. So specifically with the immunization registry, I know we all heard the discussions about vaccines specifically around COVID. And like I'm in California, so it is very like a blue state. There are lots of people that do take vaccines seriously, but there are the pockets of like the vaccine hesitant and the anti-vax. So I think a lot of it has just been like combating misinformation. or discussing vaccines with parents and providers in a way that we're like, it's not shaming them for having some questions or hesitancies, but trying to reframe it in a way that vaccines prevent disease. This is for the benefit of you and your child. But just, I think misinformation is going to be one of the very big challenges moving forward, especially with social media, just every avenue for misinformation. It really decreases the like effectiveness of public health messaging when people don't know like who they can trust or weigh all opinions equally.
A good example with the pandemic and Emmy program. Sandy?
So it's definitely those things affect our organization in terms of like when we have a new person in charge, everything shifts and it's always, we may have been focusing on one thing and now all of a sudden we have to shift our focus because of the new administration that's in office. And that can also affect different positions because we do have positions that serve at the will or at the pleasure of the appointing authority, which would be our secretary, who is appointed by our governor. So whoever the governor is at the time, that trickles down throughout the organization, and it affects a lot of different processes and, like I said, what we focus on.
We have a couple of questions in the Q&A that I think are similar in nature. So the question is about what types of skills or characteristics you look for in employees, and then how might potential job applicants sort of speak to those as they're looking to get their foot in the door.
So, I mean, the skills vary depending on with each position that we have. And we have a wide variety of roles. But I would say overall, just what seems to be the common thing throughout the organization, which is, being able to work in a team environment, have effective communication, be flexible, be able to provide great customer service as you are working with the public in a lot of our roles, and working in the community. Just be able to problem solve. So those are, the things you're going to see throughout the organization. But when you get down to very specific skills, that will just vary with each position, whether you're an epidemiologist or, an accountant, or if you're working as a nurse within our organization.
So it sounds like anything that might emphasize that in someone's experience, anything that can be emphasized in those areas, like how they're solving problems or how they have communicated effectively and things like that, might be
right.
good for them to emphasize. Yeah. Leanne, anything to add to that?
Yeah, so all of those points are really good. I agree with communication, teamwork, collaboration. I also want to mention with the communication that it's really helpful to know your audience for who you're communicating to, depending on the type of role you're in. So whether that be communications that are directed towards the general public, you want to make them accessible and understandable with like less technical jargon. You want them to be easy for them to understand. Whereas if you're discussing something with maybe a provider or someone in a medical setting, your communication style can be a little bit different. So just being able to tailor your communications to your audience as well.
Yes. A couple questions also about the types of positions that might be available for undergraduate students and for those that might be like, this might be their first job or they don't have the whole lot of experience, but are there any sort of job categories or types of jobs that might be most appropriate for those individuals?
Well, With our organization, we do have a lot of positions that have a trainee level associated with it. So we have our different career paths. They'll start off with a trainee level and you'll see it advance to like a 1 or 2 or an associate or, you know, up to supervisor. Some positions have a very broad or a much longer career path, and then some are just, maybe 1 or 2 levels associated with it. But the trainee level typically is the level that just requires maybe just a bachelor's degree, or depending if it's a little bit higher level, maybe just a master's degree, or very little experience with the trainee level. Outside of the trainee level positions, again, if you start off with a 1 or an associate with some roles, that would be considered the entry level. If you're looking at a position that maybe requires what you're ultimately looking to work in, that may require some experience, a good way to get in the door is to start off in some of our administrative series. Those are more generic positions. So those would be things like our administrative specialists, administrative officers, administrators. And I'm not sure, maybe other state agencies may have something similar, but it's a more generic classification that we utilize in a wide variety of ways, and they can encompass some of the things that you're looking for. And we have them all throughout our organization, especially within our public health and promotion administration. And they can be doing anything from accounting to grants management, to community health education. So just looking at each of those administrative options individually, and applying to those, that may be a good way to get in without having that very specific experience.
Yeah, you're reminding me, Sandy, that a lot of times in public health, what a position is not reflected in the job title. So it might be this generic title that's used across the state, no matter what agency you're in. So you really have to do due diligence in reading what the job is to determine if it's something that both you're interested in and your experience and qualifications might match with.
Exactly. You have to look at the working title for that role if it's included on the posting. Right. Yeah.
Great, thanks. Leanne, I see you came off mute.
Oh, yeah. So with that and adding on, I think Karen mentioned this before she disconnected. Don't be afraid to apply to things that are maybe not necessarily where you want to end up. If it's like a way of getting your foot in the door, getting the experience, because public health, it is very multidisciplinary. There's a lot of breadth to it. So even taking a job that you like maybe don't think that is initially the path that you want to go to, you could be exposed to other career options and be able to do like internal or lateral transfers if another position opens up as you do gain that experience.
Just want to say one more thing about that. I encourage people to apply for contractual roles as well. A lot of times we have lots of contractual positions. I know you may want to have that permanent position, but a lot of times people start off in the contractual role and then they get converted to a permanent position with us. So that's another way, another avenue for getting in. So don't be afraid to try those contractual roles. And we do offer some benefits associated with that. You may not get the same thing as someone who's permanent, but it's still a good way to get in there and get started. And I agree with there are opportunities for lateral promotions and ways to move throughout the organization through different positions.
Good advice. So I want to get to at least a couple more of these questions, and I'm going to ask a question, but I don't want to end on this one, and you'll see why when I ask it. But we have a question in the Q&A about some common mistakes you see people making when they're interviewing.
For interviews, I don't do a ton of interviewing. The interviews that I handle are more so just for my unit itself. But just in my own experience, it's not answering the question that was asked. And it's okay to take notes when you're interviewing and to ask someone to repeat a question. it's really just listening and answering the question, and just not being afraid to um to ask for more information. I think it's also important for individuals to ask questions, not necessarily the like, when are you going to hire? When do you plan, but other questions to get more details about the position or to show your interest in the position.
Yeah.
Yeah, I don't do any interviews, but just thinking about like not necessarily mistakes that I've made in interviews, but like strengths that you can bring to your interviews that you're doing is do a little bit of background research on the department, like their roles, their people, maybe what a typical day in that job position would look like, and ask thoughtful questions of your interviewers. Like one that I always liked was, what do you find most rewarding about this position? What does a typical day look like? How have you been able to grow in this role? What does a projected career path in this role look like? So just ask thoughtful questions.
Great advice. And I love how you reframed the challenge question to be more advice giving. Thank you. So we are approaching the end of our time today. I'm sorry we did not get to all of the questions in the Q&A. I was doing my best to monitor and sort of take themes that I saw between the questions and frame a question in that way. I know I'll, if it's possible, hang on for a little bit and see if there's any questions I might be able to answer in the chat. And the recording will be featured on the event page at ASPPH after today. And Morgan or Nick will send the link in the chat. And I guess since we have like 2 minutes left, Leanne and Sandy, any parting words that you have for the group today, knowing that they're likely somewhere in their educational path or dealing with providing guidance to folks that are somewhere in their educational path or pretty near graduation. Any parting words of wisdom that you have? And Leanne, I'll start with you because I see your face on the screen.
Apply early. Don't get discouraged. And then even once you get into your career, I feel like all the media discussion, it can be kind of discouraging sometimes, but you are making a difference. Even if you feel like you're in the weeds and you're not doing anything, you are making a difference in real people's lives, real people's health. Public health is a very important field, and we're glad that you all are being in the public health workforce.
Thanks, Leanne. Sandy, over to you.
Okay, well, apply to everything that you want to apply for. You don't have to limit your number of applications. We're not gonna look at you funny because you've applied to 10 positions or 20 positions. Apply for everything that you're interested in. Take advantage of the different tools that we have available or that anyone has available, like job alerts and things like that, so you can keep up with your if there's a certain thing that you're looking for. Take advantage of internships and other opportunities like that, and take advantage of all the opportunities that are out there to network, and attending things like this where you get more information about the different processes and insights into different roles, and just do your research into the organization and just the different career paths. I know that's something that we're working on, is putting out there more information about like what it's like to work here at the Maryland Department of Health, to give people that insight, because I know when you come out, you may not know exactly what a certain thing does. You know, oh, that sounds interesting, but you don't really know what they do. So just doing that research, connecting with people in that field, and just taking advantage of the opportunities.
Great, thank you. Well, that's a great way for us to conclude the webinar today. Thank you all for joining us today. Nick did pop the site where the recording will be into the chat. I'm happy to have you all join us today. Thanks for being here, and thanks to our panelists, Sandy and Leanne, and Erin in her absence. Hopefully this was helpful to you, and hope to see you all in governmental public health in the future.